Hello, my dear doctors. This is Dr. Azam here, your faculty of anatomy and PrepLadder, and now we are going to begin with the image-based discussion. And this will be including like all the high-yield images so that you have to know before going to the exam. And as we all know very well here, that we are already actually done with the INSET exam here, and now we left out with the NEET PG as well as the FMG exam. So this session is mainly for those students who are actually going to write down their NEET PG as well as FMG exam. Fine. And here we are going to discuss about all the high-yield images, my dear friends, which you should know, must know before going to the exam. Fine. Yes, I'm able to see your messages over here. Yeah, I'm good. I'm doing good. Good evening, everyone. Very good evening, everyone. Yeah. Now, first of all, as you all know very well, like in the theory classes and in our regular videos as well as in all the theory classes and all offline classes and all, we have discussed about all the concepts in detail. This session is mainly about the images, and you should be able to identify the structures in the images, guys. Okay, that is the main thing here. So let's get started with all the images one by one here. Now the first image that we are going to discuss is about the peritoneum. See, I'll be discussing from all the topics, don't worry about that. Like all the high-yield images from neuroanatomy, head and neck, upper limb, lower limb, thorax, abdomen, from all, even embryology also. From all the topics I'll be discussing, the very, very important images that you should know. Now recently in your exams, that is your NEET PG exam as well as FMG exam, they are giving the image of peritoneum. And in this, what all you should be knowing, I'll be letting you know here, my dear friends. Okay, so let's get started here right now. Now in this diagram, you're able to see the transverse section in the abdomen. And you know from the embryology part, what is going to happen is there'll be a rotation of foregut. Foregut is going to rotate 90 degrees in clockwise direction. So when the foregut is going to rotate 90 degrees in clockwise direction, therefore what is going to happen? The liver will come towards the right here. And then this one here will be your stomach here in the middle. This will be the stomach part here in the middle. And this here will be obviously the spleen. The spleen will be going towards the left. And finally behind will be having your kidneys over here, guys. Okay. So liver will be actually developing in the ventral mesentery, whereas the spleen will be developing in the dorsal mesentery. Now during the rotation of the gut, when the foregut is going to rotate 90 degrees clockwise, what is going to happen? The liver will be actually going towards the right and the spleen will be coming towards the left. That is the rotation of foregut that we know very well. Fine. Yes, of course. Very good evening, everyone, my dear friends. Yes, of course, Dr. Yash Sharma. It's getting better day by day. I'm recovering from that low back issue. It's been almost like 3 months right now. Thank you, Ramakrishna. Yes, Asif Malik, I'm back here. I'll be doing the part 2 of LRR, so don't worry about that one. Yeah, last resort revision, we'll be doing the part 2 of that one. It will be coming very, very quickly. Okay, fine, thank you. So now today we'll be doing this image-based session. Just concentrate here, my dear friends. Okay. So now after rotation, what is going to happen? The liver will be going towards the right and the spleen will be coming towards the left. Fine. Now, once you are done with this one here, now the important thing what they're asking in the exams is about the ligaments. You should be knowing the ligaments here. Now we know very well, right in front of the liver, this ligament here will be the falciform ligament. First, you should be able to identify that. Now between the liver and the stomach here, this one here will be the lesser omentum. That is your lesser omentum. Fine. Now, why is this lesser omentum not attached to the liver over here? Why? Because we have taken the section at that level where it is not attached. Now, for example, if this one here will be your stomach here, my dear friends, then this one here will be the liver here. Now, between the liver and the stomach, we know very well there will be lesser omentum here. Now, if this is the lesser omentum here, then what is going to happen? There will be like free margin of the lesser omentum here. This one here will be the free margin, and then there will be attached margin. So this here will be the free margin of the lesser omentum, and this one here will be the attached margin of the lesser omentum here. So now basically what we are going to do is we are taking the section at this level. So at this level. तो अगर आप यहाँ पर इसका transverse section लोगे तो obviously क्या होगा? Yes, on one side you're able to appreciate the liver here. On the other side you're actually having the stomach there. But in between them there will be lesser omentum. And that lesser omentum is not attached to the liver. So we are taking the section at that level, my dear friends. Okay. So between the liver and the stomach, there will be lesser omentum present over here, but that lesser omentum is not attached to the liver. That is what is important here. Now this one here will be the lesser omentum. Then after that, it's quite easy. That is why already I have written the name there. If this is your stomach over here, and if this is the spleen here, this ligament will be the gastrosplenic ligament. And if this is your spleen here and the kidney here, this ligament here will be the splenorenal ligament. And spleen को ना लीनो भी कहा जाता है, इसलिए इस ligament का नाम होगा लीनो रीनल लिगामेंट. लीनो रीनल लिगामेंट भी कहा जाता है. रिसेंटली आपके एग्जाम में ये पूछा गया था. दिस वाज आस्क्ड इन योर एग्जाम्स. ओके, recently. Fine. So this one here will be the linorenal ligament or splenorenal ligament here. Fine. Now, once you have identified all the ligaments over there, now they're asking what will be the contents of this ligament here. Number one, in what do you have in the splenorenal ligament here? You can clearly appreciate, my dear friends, in the diagram here, that there is a vessel, there is a blood vessel which is going to the spleen, and obviously it has to be the splenic vessels. Fine. So in the splenorenal ligament, you'll be having splenic vessels. Along with the splenic vessels, remember, even you also have the tail of pancreas here. Tail of pancreas bhi yahan par hota hai. Fine. So there will be splenic vessels along with the tail of the pancreas. Then what do you have in the gastrosplenic ligament? How to remember this one? I'll tell you the trick here. Now, my dear friends, you remember in the stomach, this one here will be the lesser curvature of the stomach, where lesser omentum will be attached. Fine. So obviously this one here will be the greater curvature of the stomach. Now, what are the blood vessels which are going to go along the lesser curvature of the stomach? Right and left gastric arteries. Whereas along the greater curvature of the stomach, you'll be having the right and left gastroepiploic arteries. Fine. So of course here in the gastrosplenic ligament, you'll be having the gastroepiploic arteries because it is the greater curvature. That is a trick to remember here. Gastroepiploic artery will be there, and along with that, even the short gastric arteries will also be present. They are the one which are actually supplying to what? The fundus of the stomach. तो short gastric arteries भी वहाँ पर होते हैं. Fine. Now we are actually done with these two ligaments here. अब ये दो ligaments यहाँ पर complete हो चुके हैं, तो ये तो बड़ा हमारे लिए आसान है. Now welcome to another one, falciform ligament. What is the content of this one? Now inside the falciform ligament, you'll be actually having the ligamentum teres. यहाँ पर होता है ligamentum teres. तो अगर आपने उसका डायग्राम देखा होगा falciform ligament का, in the lower border of that, you'll be able to appreciate the ligamentum teres over there, my dear friend. Now, one of the question which was asked in your FMG exam also, even in the PG exams also, like this ligamentum teres is in turn representing what? Yes, you can answer me in the chat box over there. I'm looking here. Ligamentum teres is actually representing what? Remember, the ligamentum teres is representing, come on. It is representing what, my dear friends? It is the remnant of what? It is the remnant of umbilical vein. Which umbilical vein? The left umbilical vein. आपने सीखा होगा मेरे साथ में, मैंने आपको कई बार बताया है कि in embryology when we learn, there will be actually like two umbilical veins. One is the right umbilical vein and the left umbilical vein. There will be a right and left umbilical vein. Out of that, the right will regress. Right umbilical vein will regress. Remember, this is the left umbilical vein, and after birth, it is going to, yes, obliterate, and that is nothing but your ligamentum teres. So ligamentum teres is actually the remnant of what? The left umbilical vein. Yes, of course. Dr. Ansari, perfectly right. Dr. Ravi Prakash, very good, very nice. Fine. Now comes the important thing, that is lesser omentum over here, my dear friends. Now, what is the content of this lesser omentum? Please look at this very much carefully here. In the free margin of the lesser omentum, this is the free margin of the lesser omentum, and there you have the portal triad. Now, in that portal triad, for your PG exams, you also have to remember what is the exact location of each and every structure, my dear friend. I mean to say, in the portal triad, we know very well there will be portal vein, there will be proper hepatic artery, and there will be a bile duct. But out of the three of them, remember, the portal vein will be present posteriorly. This is the portal vein here. So please remember P for P. Posteriorly, you'll be having the portal vein. Anteriorly and towards the left, you'll be having the proper hepatic artery. This is the proper hepatic artery. And anteriorly and towards the right, you'll be actually having the bile duct. There'll be bile duct. So aapko na, not only knowing the portal triad, you also have to know the arrangement of the portal triad. So in the free margin of the lesser omentum, you'll be having the portal triad. And in that portal triad, remember, I repeat again, it's worth repeating, important for your PG exams. Posteriorly, there'll be portal vein. Anteriorly and towards the right, there will be bile duct, and towards the left, there will be the proper hepatic artery. That is present in the free margin of the lesser omentum over here. Now, once you are done with this diagram, we are perfect. If this image is given in your exam, you will be able to identify everything here. Now one repeated question in your exams, my dear friend, is that, yes, behind the stomach, there will be a space here, and this space will be actually referred to as the lesser sac here. So whatever space I'm highlighting here behind the stomach here, this is lesser sac. And all the remaining space over here, this one here will be the greater sac. That is the greater sac here. Now this lesser sac and greater sac are in communication with each other with the help of this opening. And that opening here will be referred to as the epiploic foramen. So this opening here will be the epiploic foramen. That opening will be the epiploic foramen connecting the lesser sac with the greater sac over there. Now, in your recent exams, they're asking the boundaries of epiploic foramen. What are the boundaries of epiploic foramen? Now, please remember, my dear friends, if this is the epiploic foramen here, आप मेरा diagram आसानी से देखकर बता सकते हो. You can just look at this diagram here and tell me what do you have in front of the epiploic foramen. What do you have anteriorly? Anterior to the epiploic foramen, there will be the free margin of lesser omentum, which is consisting of portal triad. Easy. What do you have behind the epiploic foramen? You can clearly see that there is inferior vena cava here. So this one here will be the inferior vena cava. So we are done with the anterior boundary and posterior boundary. No need to mug up here, my dear friends. Now, once you are done with the anterior and posterior, what do you have above the epiploic foramen? Okay. Now, look at this diagram. In this diagram, this one here will be the lesser omentum here. अगर ये लेसर ओमेंटम होगा तो ऑब्वियसली दिस इज द फ्री मार्जिन हियर. मैंने आपको अभी बताया है कि लेसर ओमेंटम के बिल्कुल पीछे बिहाइंड द लेसर ओमेंटम, दैट फ्री मार्जिन ऑफ द लेसर ओमेंटम, देयर यू हैव द एपिप्लॉइक फोरामेन. सो व्हाट यू हैव अबव द एपिप्लॉइक फोरामेन? ऑफ कोर्स लिवर, but you got to remember exactly which lobe of the liver. Caudate lobe of the liver. It is caudate lobe of the liver. Be careful, already in the exam, in the options they have given quadrate lobe. It's not quadrate, caudate lobe of the liver. Okay. Then what do you have below the epiploic foramen? Below or inferiorly, you will be able to see the first part of the duodenum. The first part of the duodenum, guys. Perfectly right. Okay. तो इस तरीके से हमने क्या किया है? In this very first image in this session here, we are done with the peritoneum and the peritoneal folds and their modification and all the ligaments and their contents along with epiploic foramen. Very much important. A repeat question in your exams nowadays. It is a trending question, my dear friend. I hope my students are perfect with this image right now. Okay. Now, once you are perfect with this one here, my dear friends, let us move on to the second image. Yes, that is ischiorectal fossa. So you're able to appreciate one fossa here. This fossa will be referred to as your ischiorectal fossa, or else remember it is also known as the ischioanal fossa. So this fossa over here will be the ischiorectal fossa or the ischioanal fossa. Fine. Now we got to learn what are the boundaries of this one. You can clearly see here on the lateral side there is a muscle, and this muscle here will be the obturator internus muscle. It is obturator internus muscle. Then on the medial side also you are able to appreciate a muscle here, and this muscle here will be the levator ani muscle. So this one here will be the levator ani muscle. Along with that, on the medial side you can also appreciate that there will be external anal sphincter over here. So this one here will be the external anal sphincter. I'm just writing in short there. Let us repeat once more here. On the lateral side, there will be obturator internus here, and on the medial side, there will be levator ani along with the external anal sphincter. That is about the lateral and medial boundary of this one here. Now, why I'm giving you this image here? Why? Because in one of the exams, they have given this image-based question was given, and there was an arrow mark here, and you have to identify this muscle, and that muscle will be the levator ani. You should be able to identify this one. That is the reason why I have given you this one here, sir. Fine. Now, apart from that, what is the content? In the content in the ischiorectal fossa, you can clearly see it is filled with fat here. But along with the fat, if you just zoom this diagram over here, you'll be able to appreciate one canal, and this canal here will be the pudendal canal. And that pudendal canal will obviously have pudendal nerve along with the internal pudendal artery as well as the internal pudendal vein. Okay, so you have the fat over there along with the pudendal canal and the contents of that one, my dear friends. And that is why I have included this image here. Fine. So most of the time what will happen just before the exam, every student will be like, revising the images of neuroanatomy, head and neck and all those things, but they'll be missing these things like abdomen, pelvis and perineum. They'll be actually omitting that one. That is the reason why, first of all, I have included this one here so that you don't leave these images and go to the exam. Very much important one. Okay. Now, after this, my dear friends, let us go ahead with the next image right now. Yes. After completing about that abdomen, peritoneum image and all, now let us move towards the neuroanatomy. And now, my dear friends, I hope you are in the mood of studying right now. Please pay full attention here right now. I want your 200% attention here right now. Why? Because we are now starting with neuroanatomy. And in neuroanatomy, my dear friends, three sections of the brain, that is coronal section, sagittal section, and the transverse section of the brain are very, very much important. Without that, your exam paper will not be completed. So you have to know about all the three sections very well. Okay. So whatever exam you're preparing for right now, whether it is NEET PG exam or FMG exam, after the exam, you can just drop me a message. Yes, which section was given in the exam. Definitely one section will be given, my dear friends. So now let us become perfect with all these sections here. So with all the sections of the brain, first of all, you are able to see the coronal section here. Fine. Coronal section. Thank you, Dr. Ahmed. Thank you, Dr. Akshay. Yes. First of all, let us see the coronal section right now. The moment you look at this coronal section, you are able to appreciate here that there will be lateral ventricle here, and this one here will be the lateral ventricle here. And the two lateral ventricles are going to open into the third ventricle via a foramen. That foramen is known as foramen of Monro. Perfectly done. Now, in this diagram, you are able to see that there will be bundle of axons, white matter, connecting the right and left half of the brain. And these fibers which are connecting the right and left half of the brain are commissural fibers. The one which are connecting the right and left half will be commissural fiber. And out of all the commissural fiber, the largest commissural fiber will be the corpus callosum. So please remember, this one here will be the corpus callosum. And you can very clearly see in our diagram here, the corpus callosum is actually going to form the roof of the lateral ventricle. It is going to form the roof of the lateral ventricle here. It is going to form the roof of the lateral ventricle. Perfectly done, sir. Now, apart from that, in between the two lateral ventricles, you are able to find a septum here. In between the two lateral ventricles, there is a septum present in the middle here, and that septum is referred to as septum pellucidum. Septum pellucidum. And then the lower margin of that one, if my hand here is like septum pellucidum here, the lower margin of that one will be attached to the fornix here, my dear friend. They will be like fornix here. Extremely important. You should be able to identify that fornix in every image, my dear friend. Many a times the question has been asked from there. Fine. So in the middle, you're having septum pellucidum, and below that, there'll be like two fornix present over there. Perfectly done. And this is actually going to form what? Septum pellucidum is going to form the medial wall of the lateral ventricle. That septum pellucidum is going to form the medial wall of the lateral ventricle. Fine. Now, once you are done with the roof of that one and medial wall, now, my dear friends, remember, everything else will be actually present in the floor of the lateral ventricle. Now, what do you have in the floor? Number one, you are able to see here, this one here will be the caudate nucleus here. And then below here, this one here will be the thalamus here, my dear friends. Okay. So let me write down here. This is the caudate nucleus, and this one here will be the thalamus. Between the caudate nucleus and thalamus, if you are able to appreciate here, this vein here will be the thalamostriate vein. That vein here will be the thalamostriate vein. And then finally, you'll be also able to appreciate here that there'll be a network of capillaries over here, and that is referred to as your choroid plexus. So the caudate nucleus, thalamostriate vein, thalamus, as well as the choroid plexus, all this will be included under the floor of the lateral ventricle. You should be able to identify all the structures, my dear friend. Okay. Now, once you have identified this one, welcome to your exams. They have recently asked one question in the exam. Actually, two questions, I should say. There was a question where arrow mark was here. Identify the arrow mark structure. That will be your lentiform nucleus. And recently, my dear friend, last year they have given arrow mark at this structure here. Identify that arrow mark structure here, and this one here will be the internal capsule. Okay. So now, my dear doctors, please remember, this one here will be the lentiform nucleus here. So this nucleus here will be the lentiform nucleus here. And yes, of course, between them, whatever these fibers that you're able to see here, this one here will be your internal capsule. That will be the internal capsule. You should be able to identify all the structures over here. Now, in this section, in this coronal section, if you people are able to identify all the structures here, my dear friend, done. You are ready for any exam. Whether it is NEET PG, INSET, FMG exam, USMLE, PLAB, let them give this coronal section. You are ready for that one. Is it okay? Perfect. So in this, we are done with the lateral ventricle. Let us just revise this once more over here. Lateral ventricle, what is going to form the roof of the lateral ventricle, my dear friends? Roof is formed by corpus callosum. Medial wall here is formed by septum pellucidum here, whereas the floor is actually formed here by the fornix here, the choroid plexus, thalamus, caudate nucleus, and thalamostriate vein over there. Fine. Now, everyone here, I want your answers in the chat box, my dear friend. Recently, this exactly same image was given in the PG exam, and in the PG exam, the arrow mark was actually on this structure over here. Yes. Can anyone identify the structure? Can anyone identify the structure over here? I'm just looking at the chat box over there. Very nice, very good, my dear friends. I'm really happy. That is substantia nigra. That blackish substance that you're able to observe there, that is substantia nigra, my dear friends. Okay. ये वाला ना substantia nigra होता है, recently पूछा गया था और हम सबको पता है it is actually present in the midbrain there. Fine. After the forebrain, you'll be actually having your midbrain. In the midbrain, you'll be able to appreciate the substantia nigra over there. Fine. Now let's move ahead right now. Now, once you are done with this coronal section over here, the next diagram that I want you to understand here is again the same thing, but I want you to learn a little bit in more depth. हम सबको पता है, we all know very well this nucleus here will be the lentiform nucleus. But we also know that lentiform nucleus is made up of two things here. One will be the globus pallidus here and another one will be the putamen. And in one of the exams, they've also asked which structure will be present on the inner aspect. Which structure is present on the inner aspect, my dear friend? Is it the globus pallidus or the putamen? Come on, answer me. Keep on answering me here quickly. Fine. Now, out of this globus pallidus and the putamen, please remember that putamen will be actually present on the outer side here. This is the putamen here, whereas the globus pallidus will be present on the inner side here. This is the globus pallidus. And that globus pallidus will be in turn having two parts, my dear friend. There'll be globus pallidus internus and there'll be globus pallidus externus also present. Whatever. If this one here will be the internal capsule, if this one here will be the internal capsule over there, the structure which is more closer to the internal capsule will be the globus pallidus. So in that lentiform nucleus also, you should be knowing that it will be having putamen and globus pallidus. Putamen will be towards the lateral side, whereas the globus pallidus will be towards the medial side, sir. Okay, no, towards the medial side here. Fine. I hope this thing is done over here. And then if you want to learn a little bit more here, my dear doctors, have you ever thought why is this internal capsule known as internal capsule here? Why is this internal capsule known as internal capsule here, my dear friends? This one here will be the internal capsule, right? Now, why it is known like that here? Why? Because your lentiform nucleus is like lens shaped here. And that lens shaped lentiform nucleus has got like two capsules, one on the outer side and one on the inner side over there. Fine. The capsule on the inner side here, this one will be the internal capsule. And you can also appreciate this white matter fibers here. This one here will be the external capsule here. So that white matter fibers here will be the external capsule. And then after this, you'll be able to appreciate the sheet of gray matter, and this sheet of gray matter here will be the claustrum, that is known as claustrum. And then again, you are able to see that there is a thin sheet of white matter over here, and this one will be the extreme capsule. Oh my God. That means you actually have got the internal capsule here. Okay. This one here will be the internal capsule here. And then there will be external capsule here. And this one here will be the extreme capsule here, my dear friends. Now, between the external capsule and the extreme capsule, yes, in between them, there will be a thin sheet of gray matter. And that thin sheet of gray matter here will be the claustrum. That will be the claustrum here. And finally, this hidden lobe here will be the insula. You also have to know about this one. It was given in the image-based question. That is your insula present over there, guys. Insula, or we can also call it as insular cortex. Completely done. So here also, I have actually told you about like two MCQs here. Number one MCQ is you should be able to identify the insula here. Number two, yes, in this lentiform nucleus, you should know the arrangement of putamen and the globus pallidus. That is also asked in your exams, my dear friends. Okay. Let us go ahead with the next one, Fornix. And this is like hot favorite nowadays. Hot favorite question nowadays here. Okay. Now in this image, you are able to see here, this one here will be the hippocampus. And now from the hippocampus, there will be Fornix beginning from here like this, going all the way till here. And then finally, it will be going and attaching with the mammillary body here, my dear friends. Okay. So this one here will be your hippocampus here. This one is hippocampus here, and this one here will be the fornix here, and finally this one here will be the mammillary body, my dear friends. Fine. The hippocampus, and then from there you'll be having the fornix going and getting attached to mammillary body. Now exactly the same thing will be there on the other side also. So just look at my hands here, hippocampus and hippocampus. From both of them the fornix will begin, and the fornix is moving forward and then separating apart, attaching to mammillary body there, attaching to the mammillary body over there. Fine. Now please remember that because both the fornix are moving forward there like this, we have just now seen in the coronal section. That is the reason why in the coronal section, the fornix is visible here like this. Only you're able to see this much part of the fornix over there. Okay. Now in this diagram, you're able to see the entire fornix here, my dear friends. Okay. Now the first thing that you have to remember here is that fornix is going to begin from where? Already the question has been asked. Let me tell you like all the questions regarding the fornix here. Yes. Fornix is going to begin from where? Yes, we know very well. It is going to begin from hippocampus. And after beginning from hippocampus, it is going to mammillary body. Via what, guys? Fornix. Now the information from the mammillary body is going to where? This is also another important MCQ. It is going to anterior nucleus of thalamus. This is going to anterior nucleus of thalamus, and it is going via mammillothalamic tract. From the mammillary body, it is going to thalamus. So therefore, it will be referred to as mammillothalamic tract. Mammillothalamic tract. Understanding here? Every point is like one question over there, my dear friends. Okay. The fornix is going to begin from hippocampus, and then it is going to mammillary body, and from the mammillary body, mammillothalamic tract will be taking the information to anterior nucleus of thalamus. Even this nucleus name was asked in your exam. Anterior nucleus of thalamus. Is it okay? Fine here. Next one. Now after that, now let me do one thing here. Let me just have an interaction with you people, my dear friends. Can you people start answering me right now? Number one, question number one. Can you please tell me here that fornix belongs to which category of fibers? It is association fiber, commissural fiber, or projection fiber? Come on, my dear friends. Fornix belongs to which category of fiber? Is it association, commissural, or projection fiber? Come on, tell me, answer me right now. Remember, your answer has to be, yes, very good. Your answer has to be like all the above. It belongs to association fiber plus commissural fiber, and along with that, even the projection fiber also. And in the option, if it is given all the above, yes, it belongs to all the fibers. Number two, if you want any one best answer out of this one, remember, it is more of association when compared to commissural, when compared to projection fibers. It is more of association compared to commissural, compared to projection fiber. Now, similarly, recently in one of the exams, they have given like combination, my dear friend. Remember, it is more of association and commissural fiber. This is the right answer. If they have given any other combination, please omit that one. The best combination here will be association and commissural. And why I'm telling you like that? Why? Because if you look at our Bible of anatomy, that is Gray's Anatomy, in Gray's Anatomy, they are not including the fornix under the projection fibers. In 42nd edition of Gray's Anatomy, it's clearly given. It's not included under that one. So please remember, association commissural will be a more better answer. Okay. Perfectly done. And by this, on one slide here, my dear friends, we are done with each and every point regarding the fornix. Fornix, each and every point is completed here, sir. Now let us go ahead with the next concept. Yes, as I told you, we are going to deal with all the three sections of the brain here. So we are done with the coronal section, and now we are going to deal with the sagittal section here right now, sir. So let us cut our brain exactly in the middle and let us see the sagittal section. Now in the sagittal section, this one here, no doubt about that, is your corpus callosum. Now, my dear friend, how many parts do you have in corpus callosum? How many parts do you have in the corpus callosum? There are like 4 parts in the corpus callosum. Rostrum, genu, the body, and the splenium part. Rostrum, genu, body, and the splenium part here. Now, in recently one of the exams, they have given in a twisted manner. You should be knowing which is the anterior most part. Normally, normally what will happen is that we'll think that rostrum is the anterior most part, because rostrum, that name is used interchangeably with the anterior one. But remember, rostrum is not the anterior most part. Rostrum will be actually present below here, and then this bent here will be the genu, and this one here will be the body, and finally this part here will be the splenium part, my dear friend. So rostrum, genu, body, and the splenium part over there. So please remember, the anterior most part will be actually the genu part over here. Now, if you're done with this one here, in this diagram, we can clearly appreciate this here will be the third ventricle present over here. This is the third ventricle present over here, my dear friends. Now, what do you have just above the third ventricle? Just above the third ventricle, what do you have there? You can answer me from our previous diagram itself. Just above the third ventricle, this one here will be your fornix. And along with the fornix, you'll also have the choroid plexus over there, sir. So fornix and choroid plexus, these two are going to form the roof of the third ventricle. That you can answer from our previous diagram itself. Thoda sa little bit concentrate here. If this one here will be the third ventricle, just above the third ventricle, you'll be having the choroid plexus along with the fornix. choroid plexus and the fornix. This will be present above the third ventricle here. Now, what is going to form the lateral boundary of this one here? What is going to form the lateral boundary here, sir? The lateral you'll be having the thalamus, and below the thalamus you'll be having hypothalamus. तो ये दोनों boundaries तो हमको already पता है. These two boundaries we know already very well. Now let us see what is present anteriorly. Now just below the rostrum, this part here will be the anterior commissure here. This one here will be the anterior commissure, and this lamina here will be the lamina terminalis. This is lamina terminalis. So you should be able to identify all the structures if the image is given to you, sir. Perfect. Then apart from that, below the splenium here, this gland here will be the pineal gland, sir. This gland here will be the pineal gland, and below the pineal gland, this commissure here, this will be the posterior commissure. So please remember, below the rostrum you'll be having anterior commissure there, and below the pineal gland you should be able to identify the posterior commissure. And no doubt about this duct over here will be the aqueduct of Sylvius, which is going to connect the third ventricle with the fourth ventricle. Now, if this one here will be the third ventricle, of course, here you'll be actually having the fourth ventricle here. So third and fourth ventricle are connected by this duct, and that duct will be aqueduct. And all the structures are going to form the posterior wall of the third ventricle. And these structures here are going to form the anterior wall of the third ventricle. No doubt about that one. You know? So the diagram is like so clear there. We are done with the roof, we are done with the anterior wall, and we are done with the posterior wall here. Perfectly done. And then now welcome to the floor. Now, my dear doctors, whenever you're preparing for your PG exam or FMG exam, please remember that in every ventricle, the floor of the ventricle is very much important. The floor of the ventricle is very much important here, sir. Now, in the floor of the third ventricle, here you'll be able to see a crossing, and that crossing is referred to as optic chiasma. Just behind the optic chiasma, there will be infundibulum. Infundibulum is nothing but your pituitary stalk, and that will be attaching to the pituitary gland. Behind this one, you'll be able to appreciate the body, and this body here will be the mammillary body. And there will be a perforated substance here, which is referred to as posterior perforated substance. Posterior perforated substance, and then that posterior perforated substance, nothing but the gray matter only, and that gray matter is the one which is actually perforated by the branches from the arteries. The branches from the arteries over there, guys. And then after that, you'll be able to appreciate this one here will be the midbrain. That is your midbrain. And in the midbrain, try to recall my regular classes. I told you very clearly that there will be aqueduct here. An aqueduct is an important landmark. Why? Because whatever structure that you're able to find behind the aqueduct, this will be the tectum part here. And in front of that, this one here will be the tegmentum part. So aqueduct of Sylvius is a very important landmark. Behind that, that part will be tectum part. And in front of that, that will be the tegmentum part. So what is this for part here? So this one here will be the tegmentum part. And all together, that is going to form the floor of the third ventricle. Floor of the third ventricle here, sir. So I hope if this image will be given to you, you will be easily able to identify here, my dear friends. If this image is given to you, I told you all the structures here, my students will be easily able to identify here. Now, once you are done with this one, I told you all the structures in detail here, in depth here, and we have seen all the structures. Now, after learning all these things in depth, recently in your exam, they have just given an arrow mark at this structure here. Arrow mark at this structure there, and that was a question given in FMG exam, my dear friend. Identify the arrow mark structure. I think every student will be able to identify that one. Please answer me here. Yes, my dear friends, yes. So after learning everything in depth over there, you can see the kind of question that was given there. So they are just asking what is the mark structure. Everyone can easily identify. That is nothing but your pons over there. So I am not telling you the easy things that you can easily identify. Every medical student, even a first year MBBS student, can identify the pons here, the medulla here, the cerebellum here, the fourth ventricle. Everyone can identify. I am telling you those structures which are like very much important here, my dear friends. Is it okay? Fine. So before going exam, you please watch this video like multiple times there so that you don't miss out with the important structures, guys. Let us move on to the next image. Now the transverse section. Now, whenever you are seeing this transverse section, first you should be able to identify like exactly what is the level at which the section is taken here, sir. So now in this diagram, for example, if this one is the cerebral hemisphere here, and in this cerebral hemisphere, inside this one here will be the corpus callosum here, sir. Corpus callosum. Now in the corpus callosum, just now I told you this is rostrum, then the genu and the body, and this is the splenium here. Perfect. And we know very well this one here will be the frontal lobe here, my dear friend, and this one here will be the occipital lobe here. The frontal lobe and the occipital lobe here. Now in this diagram, we are going to take a section at this level. At that level. That means you are taking the section at which level here? At the level of genu here, sir. So in the front here, you'll be able to appreciate the genu part here, and behind here, there'll be splenium part here, sir. Now try to understand, we are taking the section at that level. So here, this one will be the genu part here, and this here will be the splenium part here, my dear friend. And don't worry about this part over here. This is actually the lateral ventricle, the anterior horn of the lateral ventricle here. And this one here will be the posterior horn of the lateral ventricle. You know very well that lateral ventricle will be actually having that anterior horn, the posterior horn, the inferior horn and all. So that will be the horns of the lateral ventricle, the genu and the splenium. Now, my dear doctors, look here. These white matter fibers which are going to get attached, the white matter fibers which are going to connect the genu with the frontal lobe, this one here, the genu with the frontal lobe here, this one here will be the forceps minor. Forceps minor. And then the splenium is connected to the occipital lobe here, and these fibers here will be the forceps major. Forceps major. So the genu is connected to the frontal lobe with the help of forceps minor, whereas the splenium is connected behind with the occipital lobe, that is by forceps major. And now what is going to happen from the body? There's a body of the corpus callosum. It is not visible here. You just try to understand. You also have the genu and the splenium is connected with the body there, body of the corpus callosum. Now from the body of the corpus callosum, there are certain fibers which are going here, and these fibers are actually referred to as your tapetum fibers. These fibers are actually the tapetum fibers here, sir. Okay. Fine here. Understanding, my dear friends? Now I'll show you one beautiful diagram here. Look at this diagram here. Okay, this diagram is nothing but of cerebral hemisphere here, and we are looking from above. हम यहाँ पर उसको ऊपर से देख रहे हैं, और अगर आप इसको ऊपर से देखोगे तो in the corpus callosum, this one here will be the genu part here, and this one here will be the body of the corpus callosum, and behind you'll be able to appreciate the splenium part here. Now these fibers which are going to connect the genu with the frontal lobe here, this will be the forceps minor, and these fibers which are going to connect the splenium with the occipital lobe here, these fibers will be the forceps major, and from the body, the fibers which are going on the lateral side here, that one will be the tapetum fibers, guys. Okay, and in the PG exam, they have given about the posterior horn of the lateral ventricle. Now, if you go back and look at my lectures there, look at my videos there, I have explained you very, very clearly, my dear friend. Posterior horn में actually क्या होता है ना, there will be actually bulb of the posterior horn, and that bulb of the posterior horn will be formed by this tapetum fibers there. Sorry, the bulb of the posterior horn is formed by the forceps major fibers there, guys. Okay, bulb is formed by the forceps major fiber over there, and tapetum fibers are the one which are going to form the roof and the lateral wall. The roof and the lateral wall. I hope it is crystal clear here. Now once you are done with this one, remaining structures तो already आपको पता है, मैंने already बता रखा है. Let's see the remaining structures. It will be like a revision for us. This one again here will be the caudate nucleus, and this one here will be the thalamus, and this one here will be your lentiform nucleus. And this capsule on the inner side here will be the internal capsule here, my dear friend, and this capsule here will be the external capsule here. And this thin sheet of gray matter that you're able to see here will be the claustrum, and after that you'll be able to appreciate the extreme capsule here, and yes, of course, this one here will be the insular cortex, or simply insula. You know that very well. No need to worry about that one. So in transverse section, before going to the exam, I want you to please concentrate on the structures which I have marked over there. I hope it is crystal clear right now. Now by this, my dear friend, we have actually completed the 3 sections in the neuroanatomy. Believe me, trust me, the exam paper will not be completed without a question from these 3 sections. Definitely there will be one section given in the exam. So I am requesting you, before going to the exam, please watch these videos n number of times so that you'll be perfect here. Perfect here, my dear friends. Is it okay? The coronal section हो गया है, transverse section हो गया है, as well as sagittal section is also done in a crystal clear manner. I hope this is like useful to you. चलिए सर आगे बढ़ते हैं. Let us go ahead right now. Yes. Now recently in the exam they're also giving you this transverse section of the midbrain as well as the medulla oblongata also. So let us try to identify here. This is the transverse section of midbrain, easy to identify. The moment you look at the transverse section of midbrain, in the middle there will be a duct here, and this duct here will be the aqueduct of Sylvius, also known as the cerebral aqueduct. And based on this cerebral aqueduct over here, my dear friend, remember it will be again divided. This structure that you're able to see behind the cerebral aqueduct ke piche, this part here will be referred to as tectum, and in front of that, this part here will be referred to as your tegmentum part. Fine. And then of course this one here will be your cerebral peduncle. In the cerebral peduncle, this white matter part here will be referred to as the crus cerebri. And yes, of course, you only told me just now, this blackish substance over here will be referred to as substantia nigra. My dear friends. Okay. And try to recall, in the midbrain, you will also be able to appreciate. In the midbrain, you'll be able to also appreciate there'll be like big nucleus which will be appearing like more reddish in color. And this one here will be your red nucleus. That is your red nucleus. Okay. So red nucleus is present in midbrain, and that too at which level? At the level of superior colliculi. Fine. It's so simple to easily identify the midbrain by all these features over there. Now if there is a cerebral peduncle on one side here, there will be cerebral peduncle on the other side here. Between the two cerebral peduncles, there will be a depression here. This depression is referred to as interpeduncular fossa. In between the two peduncles, there will be a fossa in the middle, and that is nothing but your interpeduncular fossa, my dear friend. The name is very much simple. Inter, in between the two peduncles. Intermediate, beach mein, darmiyan mein, madhyalo untundi, andukosam danni interpeduncular fossa antaru. Okay, I hope this is like crystal clear, my dear friends. Yes, of course, we have discussed about all the, the syndromes of midbrain, the pons and medulla oblongata, everything in detail. But right now, this session, let me limit this session to image-based session only. So if the image is given, you should be able to identify all the structures, guys. Perfectly done here. Now look at this image here. Again, you're able to see here, this is the midbrain here. तो जैसे मैंने आपको अभी बताया है, तो आप easily इसको identify कर सकते हो. This one here will be nothing but your midbrain here, sir. Now, if this one is midbrain here, I told you there will be cerebral peduncle and cerebral peduncle here. Between the two cerebral peduncle, there will be interpeduncular fossa. Now, this one here will be the optic nerve here and the optic nerve here, and therefore the crossing here will be the optic chiasma. This is optic tract here and optic tract here, sir. It is all going to form the boundaries of the interpeduncular fossa. Now, the question is, what is the content of interpeduncular fossa? In the interpeduncular fossa, there are like totally 4 contents here, my dear friend. Number 1, you're able to appreciate the infundibulum, which is nothing but the pituitary stalk that is getting attached to the pituitary gland. But here in this diagram, we have actually removed that one. That infundibulum is along with the tuber cinereum wala part. This is the tuber cinereum here. Then just behind that one, you'll be able to appreciate these two bodies here, mammillary body and the mammillary body here. And then this perforated substance here will be the posterior perforated substance. And then yes, of course, you'll also have the cranial nerve number 3. The cranial nerve number 3, oculomotor nerve. So infundibulum along with the tuber cinereum, mammillary body, posterior perforated substance along with the oculomotor nerve, all this together are the contents of your interpeduncular fossa. Interpeduncular fossa here, my friends. Is it okay? Yes. So in this manner, you're able to identify the images here. You should be able to identify all the structures in the images, my dear friend. Midbrain is also done. Now look at this diagram. In one of the exam, they have just given simply diagram here, and they have just asking you to identify it is a transverse section of midbrain, pons or medulla oblongata. Can you please identify here, my dear friends? Can you please identify it is a transverse section of midbrain, pons or medulla oblongata? Floor of third ventricle. Dr. Pratiksha. Yes, thank you, my dear friends. You still remember the offline classes, the fun we used to have there. Yes, this is actually the medulla oblongata here, and you can easily identify the medulla oblongata here. Why? Because yes, behind the medulla oblongata there's a ventricle here, and this ventricle here will be the fourth ventricle. Then apart from that, anteriorly you're able to see this here elevation. This elevation will be the pyramid here, And this elevation here will be the olive, and you can clearly appreciate there will be inferior olivary nucleus here. The shape of this inferior olivary nucleus is very unique there. It is actually crumpled paperback shape. Crumpled paperback shape. That is how you can easily identify it is medulla oblongata. So on the ventral aspect, in front of the medulla oblongata, you'll be able to see the pyramid as well as the olive over there. Whereas behind, there will be the fourth ventricle. In this manner, you can easily identify here. चलिए आगे बढ़ते हैं sir. In this manner, I think now there'll be no confusion in identifying the transverse section of midbrain as well as the medulla oblongata. Now moving ahead, yes, of course, in this diagram, you're able to see the blood supply to the brain. It is by circle of Willis. Now, if this kind of cadaveric image is given to you, you should be able to identify all the blood vessels over here. Actually, this image of circle of Willis look very good in our textbooks. In the textbooks, we'll be drawing the diagram nicely with that red color, blue color, and all those things. It looks very well. If this image is given to you, cadaveric image is given to you, you should be able to identify here. So, now in this diagram, first I'm able to appreciate these two arteries which are going to move up here, and this will be your vertebral arteries over here, sir. So this one here will be the vertebral artery, and this one here will be the vertebral artery here. Now these two vertebral arteries will combine together, and together they are going to form the basilar artery here. And you can very clearly see the basilar artery is lying on the pons there. And finally, what is going to happen? The basilar artery will be finally going here and dividing into the posterior cerebral arteries. The basilar artery will finally go and finally divide into the posterior cerebral arteries over there, guys. Fine. Now in this diagram, further anteriorly here, you'll be able to appreciate here, this is the internal carotid artery here. This is the internal carotid artery here. And that internal carotid artery is in turn giving rise to a branch. You can clearly see it's going here. It is going between the two cerebral hemispheres there. And this one definitely will be the anterior cerebral artery. And the one which is going here, this one here will be the middle cerebral artery here. And this anterior cerebral artery and middle cerebral artery, both of them are coming from the internal carotid artery itself. Those two are the branches from internal carotid artery itself. And now you can appreciate one more branch here, which is going to come and join with the posterior cerebral artery, that is your PCOM. So this one here will be your PCOM, posterior communicating artery here. So posterior communicating artery will be coming and joining with the posterior cerebral artery. Definitely done here, sir. Now once you are done with this one, please observe this very carefully. It's very much important for your PG exams here, my dear friend. Now this one here will be the basilar artery. I told you very clearly, it is basilar artery here. And basilar artery will be giving rise to a branch to cerebellum from above, and this branch here will be the superior cerebellar artery. Superior cerebellar artery here, sir. Okay, it is giving a branch to the cerebellum from above, that is superior cerebellar artery. Fine. Now between the posterior cerebral artery here and the superior cerebral artery here, if you're able to see clearly, okay, you are able to see here that there is a nerve which is going to come out from here. So there's a nerve which is going to come out from here, and that one will be your third nerve, and even there'll be the fourth nerve. So that was a question also asked in your exam, that third nerve and the fourth nerve. Third nerve and fourth nerve, my dear friend, that is oculomotor nerve and trochlear nerve, are present between which two arteries? Please remember, they are present between the posterior cerebral artery and the superior cerebellar artery. Posterior cerebral artery and the superior cerebellar artery there, guys. Third and fourth nerve will be coming out between them. Easy to remember. So I hope in this cadaveric image now you'll be easily able to identify all these arteries over here. So I hope this is like crystal clear, my dear friends. You should be able to identify all these things over here. Now, once you are done with this one, let us move on to the next image here. Yes, how can you forget another very important topic here, my dear friends? Now, this topic here is actually about the diaphragm and the openings of diaphragm here. So, openings of diaphragm here, guys. Okay, now diaphragm and openings of diaphragm, extremely important. Now, this diagram is actually like diaphragm is dome shape, you know very well, and we are actually lifting the diaphragm and we are seeing from below. We are lifting the diaphragm and seeing from below there, guys. Okay. Fine. Dr. Rafa is telling about the inferior cerebellar arteries. If you are able to see here, Dr. Rafa, inferior cerebellar arteries will be seen here. This one here. Now you are able to see this one here. Yes, one artery here, inferior cerebellar artery here, and another one coming from the vertebral artery here. This one here. That will be your ica and pica. Ica and pica. So basilar artery will actually give rise to a branch. This one here will be your ica here, whereas vertebral artery will actually give rise to the pica here. So that will be the inferior cerebellar artery, anterior inferior cerebellar artery and posterior inferior cerebellar artery. Okay. Yes. Done. I hope that is done, my dear friend, Dr. Rafa. Now, moving on to the diaphragm here. Yes, we know very well there are like three major openings in the diaphragm. Number one will be the vena cava opening here. Number two will be the esophageal opening here, and number three will be the aortic opening there, guys. And we remember with the sequence as Voice of America, that is at T8 and then T10 and then there'll be like T12. Fine. Now you have to remember what are the structures passing from these openings here. Vena cava opening, of course, there will be inferior vena cava. Please write that and forget about that one. Why? Because of course it is vena cava opening, and what is going to pass from there? Inferior vena cava is going to pass from there only. So they will never ask you that one, sir. Now, along with that, what else is going to pass from here? Please remember there will be a right phrenic nerve is going to pass from there, guys. Along with the inferior vena cava, right phrenic nerve is going to pass from here. Now, esophageal opening, what is going to pass from here? It will be esophagus. Now, along with the esophagus, please remember the vagus nerve is also going to pass from here. Both the right and left vagus nerve is going to pass from here. And from the aortic opening, what is passing from here, guys? Of course, there will be aorta passing from here. Along with the aorta, there will be thoracic duct. There will be thoracic duct, and along with that, even the azygous vein is also going to pass from here. Azygous vein is also going to pass from here. So, fine. So aortic opening se kya pass hoga? Aorta along with the thoracic duct as well as the azygous vein is also going to pass from here. Now, once you are done with this one, recently in the exam, they have started asking about the posterior abdominal wall. So posterior abdominal wall, they're giving you the transverse section. In that transverse section, you should be able to identify the psoas major muscle and quadratus lumborum muscle. Of course, they'll be enclosed in a fascia that is referred to as your thoracolumbar fascia. We have already discussed in detail about that one. The thoracolumbar fascia will be actually having like three layers there. There will be anterior layer, middle layer, and the posterior layer. But whatever here, now in this diagram, what you can identify here, my dear friend, the muscle which is very much near to your vertebrae here, towards the medial side, towards the vertebrae there, and that muscle here you can easily identify. That one will be the psoas major muscle, and just lateral to that one, you'll be able to appreciate the quadratus lumborum. Lateral to that one, you'll be able to appreciate the quadratus lumborum there, guys. Don't get confused with these muscles present behind over there. They'll be actually your true back muscles, and those will be your erector spinae muscles, my dear friend. Erector spinae muscles, fine. That is about this diaphragm topic that you have to remember. Now, why I have included this in our image-based session right now here? Recently, this image of diaphragm was given, and there was an arrow mark on the aortic opening, and what are the structures passing from this opening over here? You should be knowing that one. Is it okay? So that's the reason why you should know about this image also. Now, once you are done with this one, nowadays the hot favorite one. Recently, it was also given in the INSET exam. I'm telling you, 2025 INSET exam also it was given this image, transverse section, and it is like repeated in your NEET PG as well as FMG exams also. They're giving the transverse section of the thorax, and in that they're actually asking you about the chambers of the heart and all those structures. Now, my dear friends, if you recall our classes, offline classes, or if you go and watch my videos on PrepLadder, I've explained you many times about the positioning of the heart. And I hope my students who have gone through my regular class, they know very well. One important sentence that you have to remember is that our heart is positioned like a fallen cone on one of its side. Our heart is like a fallen cone on one of its side here. Okay, it is like a fallen cone here like this. If it is like a fallen cone, agar aap aage se dekhoge, when you're seeing from the front, of course you'll be able to see only the right atrium, and below there will be right ventricle. So when you're seeing from the front, there will be right atrium and right ventricle. Then where exactly you'll be actually having the left atrium and left ventricle? Behind that one. Just keep that thing in mind. The moment you look at this diagram here, easily you'll be able to identify. Of course, this is the posterior aspect over here. You're able to see the vertebrae there. This is the posterior aspect over here. And this one here will be the anterior aspect over there. You'll be able to appreciate the sternum there. Now, when you're seeing from anterior aspect, you're able to see the right atrium, and below that there'll be right ventricle there. Behind that, you'll be able to appreciate the left ventricle and the left atrium there, guys. Okay, so that is very much easier to remember here. And if that is your left atrium, obviously the vessels which are going to drain into that one has to be your pulmonary veins there, guys. Understanding? So in this manner, it's very much easy to identify the chambers of the heart. It was recently given in the INSET exam, and previously it was given in FMG many a times here. It's easy to identify. Just remember my one sentence over there. Our heart is located like a fallen cone there. Okay, so if it is located like this, you'll be able to appreciate the right atrium, below right ventricle, and behind that there'll be left atrium and left ventricle. I hope you'll be easily to identify this one here, sir. Take it. Next one, moving on to the next image here. Now, another very important thing that is about muscles of mastication. My dear friends, if you ask me, like, sir, say one question which can be like definitely asked in your INA exam or NEET PG exam. Remember that is about the muscles of mastication. They are not at all getting tired of asking. Again, recently also they have asked about the muscles of mastication. Okay. Now, because this is like image based session, yes, I have to discuss the images with you. You should be able to identify. We know that there are totally like 4 muscles of mastication. Fine. Everyone will be easily able to identify the masseter here and temporalis. I did not include that image. I don't want to waste your time by showing you like easy images. Easy images you can easily identify. The masseter temporalis, everyone will be knowing. The students are getting confused with the lateral pterygoid and the medial pterygoid here, sir. Lateral pterygoid and the medial pterygoid, guys. Fine. Now, in this diagram, you are able to appreciate the muscle here, and this muscle which is going and getting attached to. Now, this muscle which is going and getting attached to the capsule of the temporomandibular joint. The capsule of temporomandibular joint, that muscle is actually the lateral pterygoid muscle. This is lateral pterygoid muscle. And this muscle which is attaching to the mandible here on from the inner aspect will be the medial pterygoid muscle. Recently in the NEET PG exam, they have put an arrow mark here. You should be able to identify it is lateral pterygoid muscle. Lateral pterygoid muscle, guys. Perfect. Now, for example, let me just draw a small diagram here. Try to understand like this here, my dear friends. Now, if this one here will be the head of the mandible here, okay. Now this one here will be the head of the mandible here, and that is going to form the joint there, okay, with your temporomandibular joint. Now, if this one here will be the joint capsule, अगर मान लो कि ये वाला joint capsule यहाँ पर, ठीक है ना? Now, the lateral pterygoid muscle will be attaching here like this here. This one here will be the lateral pterygoid muscle. But what is going to happen with the tendon of that one? Remember that tendon of the lateral pterygoid muscle is the one which is going to form the disc here, which is referred to as the articular disc here, sir. So lateral pterygoid muscle will be attached to the capsule over there. The tendon of that one will be remaining there as the articular disc. And because of that articular disc, what is going to happen? The joint cavity, temporomandibular joint, the cavity inside that will be divided into like 2 compartments. There will be one compartment above here, upper compartment, and there will be one compartment below here. This will be the lower compartment. So temporomandibular joint, inside that there will be articular disc. That articular disc is nothing but what, guys? It is nothing but the remnant of your tendon of lateral pterygoid muscle only. Is it okay? So this is like very important image. Muscles of mastication आपको definitely पढ़कर जाना होगा. And remember, I taught you with that 5 points. Just with the 5 points, you'll be able to answer any question about the muscles of mastication. Remember their actions and everything, guys. Is it okay? And if this image is given here, don't get confused with this muscle over here. This muscle over here will be the buccinator muscle. That is your buccinator muscle here, and that is not actual muscles of mastication. It is actually the accessory muscle of mastication here. Accessory muscle of mastication, guys. Clear? now welcome here. Yes, my dear friend, Dr. Nitya Kumar. Yeah, Dr. Nitya Kumar, the moment you asked me about the image of buccopharyngeal fascia, which was given recently, yes, you are able to see right now here this image. Another very important concept here, which is nowadays trending in your exam. So I think all my students who are listening to my session from the very beginning, I hope you're understanding here. I'm not showing you all like those regular images that you'll be knowing already. तो आप सबको पता है, we have been conducting like many revision session, rapid revision, all those things. तो आपको सारे images तो पता है. Now I have mainly included those images which students will be tending to forget before going to exam, to revise that one. So that is the reason why I have included here. Yes, this is like one of the concept which is being repeatedly asked in your exams nowadays. I hope you are able to see in this diagram here. This is like your oral cavity. Above there is the soft palate here. So we are opening the mouth and seeing the oral cavity. Above there is a soft palate, and below here the tongue part here. Fine. And then now we are actually looking at the tonsils here. Now in the tonsils there will be medial surface, and then there will be the lateral surface here. Medial surface easy to identify. Why? Because you'll be having clefts there, and those clefts are nothing but the tonsillar cleft. Tonsillar cleft. Out of all these tonsillar clefts, you are able to appreciate that there is one big cleft over here, the biggest one. And that one here will be referred to as the intratonsillar cleft. Intratonsillar cleft. और it is also referred to as the crypts also. तो इसलिए इसको कहा जाता है crypta magna also. Crypta magna भी इसको कहा जाता है. Clear? Now once you are done with this one, they are asking you about the tonsillar bed. Okay, now what is going to form the tonsillar bed? Remember, in the bed of the tonsil, first of all, you'll be having the superior constrictor muscle. In the tonsillar bed, first of all, you'll be actually having the superior constrictor muscle here. Try to understand as I'm telling you, first of all, here, sir. Okay, now, first you're able to see a muscle here, and this muscle here will be the superior constrictor muscle. Now that superior constrictor muscle will be having the fascia, one fascia on the inner side and one fascia on the outer side here. On the inner side, that fascia will be actually the pharyngobasilar fascia, and on the outer side, that fascia will be the buccopharyngeal fascia. That fascia will be the buccopharyngeal fascia. Fine. On the inner side, that will be attaching from the base of the skull to the pharynx. Base of the skull to the pharynx. Concentrate on my word, and that is why the name is given as pharyngobasilar. Base of the skull with the pharynx. Pharyngobasilar. And then outside will be actually having the buccopharyngeal fascia. Buccopharyngeal fascia. So these three together, they're actually going to form your tonsillar bed here. पहले आप ना इनको ध्यान से याद कर लीजिए. First you learn this very carefully. Now once you are done with this one, remaining things are very much easier. Of course, the tonsil will be covered by a capsule here. That is the capsule on the outer side. Now between this capsule here and this tonsillar bed here, you'll be able to find, yes, there is a fascia here, and that will be the peritonsillar fascia. In that, you'll be actually able to find the vein here. That vein will be the paratonsillar vein. That vein there will be the paratonsillar vein, guys. That is very much important. Okay, now once you are done with this one, yes, outside there you'll be also able to appreciate one nerve here. ये भी बहुत important है, and this nerve here will be the glossopharyngeal nerve here, guys. That will be the glossopharyngeal nerve. Now, why that glossopharyngeal nerve is very much important? Why? Because, yes, my dear friend, remember that glossopharyngeal nerve will give one of the branch which is going to your middle ear there. Middle ear, the tympanic plexus. It will be contributing to the tympanic plexus, and that branch will be the tympanic branch of the glossopharyngeal nerve. Fine. Now, what is going to happen whenever there will be tonsillitis there? You know very well, the pain will be referred into your ear. And the pain will be referred into that ear because of which nerve here? That glossopharyngeal nerve, the tympanic branch of the glossopharyngeal nerve, guys. Tympanic branch of the glossopharyngeal nerve. Are you understanding your point here? That is why it is very much important there. I hope this concept is very much clear here. Yes, tonsillar bed, this concept is very much important nowadays. They are giving like many times the image based question based on this one here, sir. Is it okay? Now, once you are done with this one, welcome here, my dear friends. Look at this diagram. Another diagram here about the transverse section of the neck. In this image, what type of questions will be asked here? Let us discuss all that questions here. See, first of all, this is the transverse section of the neck where you're able to appreciate all the fascia. Now, this is the fascia which will be surrounding the entire neck here, enclosing the sternocleidomastoid muscle, and this one here will be the trapezius muscle. And this layer here will be the investing layer. Then this sheath here, we know very well, this sheath here will be referred to as your carotid sheath. Okay, we know that very well. And the fascia which is surrounding the thyroid gland here, this one here is actually in front of the trachea. So therefore it will be referred to as pretracheal fascia. And then finally the one which is yellow colored one here surrounding the vertebrae and all, it is referred to as the prevertebral fascia. Prevertebral fascia. Now these are all what, guys? These are all the modifications of the deep cervical fascia. So deep fascia of the neck will be having all this modification. Number one, the investing layer, the pretracheal fascia, the carotid sheath, and the prevertebral fascia. All these are the modification. Now in your exams, what they're doing is, they're actually giving you this image and they're asking you about the nerves here. You should be perfectly able to identify all the nerves. Now, I'll mark here and you try to identify. My dear friends, can anyone identify this nerve over here? Come on, can you identify that nerve, sir? Can you please identify this nerve here right now? Yes, of course, it is your 10th nerve here, sir. This one will be the vagus nerve here. Now, how can you identify this one as a vagus nerve? Absolutely correct, Dr. Krishna. Absolutely correct, everyone here. It is vagus nerve. How can you identify? Yes, it is the one which is present inside the carotid sheath, guys. It is the one which is present inside the carotid sheath. That is your vagus nerve. Done. After that, in this diagram, you're able to see here, this one will be the trachea here. And this one here will be the esophagus here. Now, between the trachea and the esophagus here, this one here, tracheoesophageal groove. And this nerve here will be the recurrent laryngeal nerve here. So that is the recurrent laryngeal nerve, guys. Perfect. Then after that, yahan tak to easy hai. It is very much easier. Can anyone identify this nerve over here? Can you please identify this nerve here, sir? That nerve we can easily identify. Yes, with the help of the relations of the carotid sheath. Try to recall, if this is the carotid sheath over here, what do you have behind the carotid sheath? Behind that one, there will be sympathetic plexus. Yes, that will be the sympathetic trunk over there, sir. So behind the carotid sheath, the posterior relation of that one will be the sympathetic trunk here. And now we are left out with two more important things here. Identify this one here and this one here, guys. What is this one now? Now in this diagram, first of all, you should be able to understand this is your scalenus anterior muscle and this is the scalenus medius muscle and scalenus posterior here. So there will be scalenus anterior, scalenus medius and the scalenus posterior. Now the nerve that will be able to find in front of the scalenus anterior, this nerve here will be the phrenic nerve. This nerve here will be the phrenic nerve. Important, already asked in your NEET PG exam. So how to identify that one? The nerve which is present in front of the scalenus anterior, that will be the phrenic nerve. Now between the scalenus anterior and scalenus medius, this will be actually the brachial plexus. And this one we have been learning from our first year MBBS days. The brachial plexus is going to begin from C5 to T1 and then it is going to exit out and it is going to come out between these two muscles. That is your scalenus anterior and the scalenus medius one, guys. So I think in this diagram, you should be able to identify all these nerves and that is something important point to remember, guys. Okay, and remaining concepts, so you already know we have discussed in our classes in detail. So in the image based session here, in this image, you should be able to identify all these nerves. Try to revise them before going to the exam, sir. Next one. Now in this image, can you please tell me in the very first image, which nerve will be involved here? Whenever there will be a fracture of surgical neck of humerus. Whenever there is a fracture of surgical neck of the humerus, what is the nerve involved here? Come on. What is the nerve involved here? Of course, that will be your axillary nerve here. Now in the diagram number 2, you can see there is a fracture of shaft of the humerus here. And if the humerus, shaft of this humerus is fractured here, which nerve will be involved? That will be a radial nerve, sir. A radial nerve is the one which is going to pass in that groove. That groove is referred to as radial groove or the spiral groove. And finally, in the last diagram, we can see the fracture of medial epicondyle. Behind the medial epicondyle, the nerve passing from here will be your ulnar nerve. Okay, and this concept is very, very much important if you're appearing for your FMG exam, my dear friends. Why? Because many a times they're giving the question about the nerves related to humerus. So please remember that there'll be like totally 3 nerves which are related to humerus. Number 1, the axillary nerve here, which is going to pass behind the surgical neck of humerus. Number 2 will be the radial nerve here, which is going to pass in the radial groove or the spiral groove behind the shaft of the humerus. And number 3 will be the ulnar nerve, and this is the one which is going to pass behind the medial epicondyle. So please remember these 3 nerves. Always they are giving image based question. In one of the FMG exam, they have given a person standing there and there was an arrow mark near this elbow here, medial epicondyle. What is the nerve which is going to pass behind that one? Please remember it will be your ulnar nerve. So there are 3 nerves which are related to humerus directly. Please remember that one, sir. Now, how can we leave this image? This is another very, very important image that they are asking the exam about the Trendelenburg sign. And there are like so many questions related with this one. Number 1, in the given image, like what is the nerve involved? We know very well in the Trendelenburg sign, what is the nerve involved? Is it inferior gluteal nerve or superior gluteal nerve? Please remember that one will be the superior gluteal nerve. So what is the nerve involved here, sir? The superior gluteal nerve. And it is the one which will be supplying to the gluteus medius as well as the gluteus minimus muscle. Gluteus medius and gluteus minimus muscle will be involved over there. But important thing, remember that will be actually on the contralateral side here, sir. Now, for example, the person here is actually standing on the right foot here. The left foot is off the ground and you can clearly see here, the left side of the hip will be actually sagging. So if there's a dropping of hip on the left side, then which muscle? The right right superior gluteal nerve will be gone. So because the right superior gluteal nerve will be gone, that is the reason why the gluteus medius and minimus, these two muscles will not be able to abduct the hip there. The hip will be actually dropping on the other side. So in this diagram, according to this diagram, I'm telling you, if the hip is dropping on the left side there, that remember the right superior gluteal nerve will be actually involved. Sir. The right superior gluteal nerve will be involved. Perfectly done here, sir. Now, another very much important diagram here, that is about the tarsal tunnel. Now, first of all, you got to remember like all the structures which are passing through the tarsal tunnel over here. Now, the structure which are passing here, you're able to appreciate one tendon here, that is a tendon of tibialis posterior. There is one more tendon here, that is a tendon of flexor digitorum longus, and one more tendon here, that is a tendon of flexor hallucis longus. Fine. There'll be like three tendons which are going to pass from here. But the important thing is about the artery and the nerve which is going to pass from here. So tibial nerve is going to pass from there along with the posterior tibial artery. And nowadays in your exams, this artery is very much important here, sir, posterior tibial artery. They are giving this image based question like a doctor is keeping his fingers over there and trying to, palpate. So we are able to palpate the pulse. The pulse will be actually palpated over there with the help of which artery? The posterior tibial artery. That is the question. That is an important question. You have to remember this. And all these structures which are going to pass from the tarsal tunnel, you have to remember them in order. And yes, we know that very famous mnemonic, Tom, Dick and Harry, है ना, जैसे हम याद करते हैं हमारे classes में. तो please remember that one, guys. Now, once you are done with this one here, the next one is about the femoral triangle here. Now, in this diagram, you are able to appreciate here, on the lateral side, there will be sartorius here, and on the medial side, there will be adductor longus muscle, and then here there will be inguinal ligament. Between these three, there will be a triangle, and this triangle here will be the femoral triangle. Fine. Now, this was given as an image-based question. In this, they have asked about the floor of the femoral triangle. Now, there are totally like four muscles which are going to form the floor of the femoral triangle. Number one here, you'll be actually having your iliacus muscle along with the psoas major muscle. You can remember them as iliopsoas. And this one here will be the pectineus muscle. And then finally, this one here will be the adductor longus muscle here. All these four muscles are the one which are going to form the floor of the femoral triangle. And of course, you cannot forget this muscle over here. This one here will be the sartorius. Anyone can easily identify this one. Fine. But important thing about the sartorius, 2 points, remember, it's going to originate from where? It is going to begin from anterior superior iliac spine. So sartorius kahan se begin hota hai? It's going to begin from, originate from anterior superior iliac spine. And not only that, you also have to remember about the action of sartorius. So I'll be just writing here, what is the action of sartorius? Sartorius muscle, it will be acting at two joints here. So number one, it is acting at hip joint also, as well as it is going to act at the knee joint also. Hip joint as well as knee joint. Now at the hip joint, please remember it is helping in flexion. Flexion at the hip joint. Just try to imagine a person sitting down with the legs crossed. Okay, now, with the crossed legs, if you're sitting down there, in that position, what is going to happen at the hip joint? It will be flexed. Along with the flexion, please remember it is also helping in abduction. And then it is also helping in external rotation there. Okay, so flexion, abduction, moving the thighs away, and then external rotation. And then at the knee joint, I told you very well, imagine a person sitting with a crossed leg. At the knee joint also it will be helping in flexion. So this is the action which is done by the sartorius. That is the reason why in one of your exam, the question that was asked was, which muscle will be helping in flexion at both knee joint as well as hip joint simultaneously. So which muscle will be helping in flexion at both hip joint as well as knee joint simultaneously? That one will be your sartorius muscle, sir. So this one here will be the sartorius muscle like this here. Now once you are done with this one here, this muscle here easy to identify. This one will be the tensor fasciae latae. And yes, of course, this muscle here will be the quadriceps femoris. Please be very careful with the spelling there. It is not quadratus femoris. It is quadriceps femoris. Having that four heads, vastus lateralis, vastus medialis, and then in the middle there will be vastus intermedius, and in the front you'll be able to appreciate their rectus femoris here, sir. So vastus lateralis, the vastus medialis, and then rectus femoris. Vastus intermedius will not be seen in this diagram. Okay. Clear? So in this manner, you'll be easily able to identify here, sir. Now, once you are done with all these muscles, you'll be able to identify in the image here. Thank God. Let's move ahead with the next image here. Yes, spring ligament. Can anyone just tell me what is the another name of the spring ligament here? What is the another name of the spring ligament? what is the another name of the spring ligament there? In the diagram, you can clearly see this bone here will be the calcaneus here. And this bone here will be actually the navicular one here, sir. And yes, between the calcaneum and the navicular, you're able to see this ligament. And that is the reason why the name of the ligament will be calcaneo-navicular ligament. And of course, it is actually in the plantar region. So plantar calcaneo-navicular ligament here. So this is the important question that you have to remember, and you should be able to identify that ligament. And that is the ligament which is actually supporting the medial longitudinal arch. When you learn about the arches of the foot, there'll be like one medial and another one is a lateral. So the important ligament which is actually supporting the medial longitudinal arch will be the spring ligament, and that is also referred to as your calcaneo-navicular ligament, the plantar calcaneo-navicular ligament, sir. Now another ligament which was given in your PG exams, you have to identify this ligament here. Actually, this one here will be the calcaneo-navicular ligament here. Another one will be the calcaneo-cuboid ligament, and together it will be actually referred to as the bifurcate ligament here. It will be the bifurcate ligament. So you're able to see that there'll be like two of them. One will be the calcaneo-navicular ligament and another one will be the calcaneo-cuboid ligament, and together that will be like bifurcate ligament over there, guys. Okay. Now this image was also given in your exams there, my dear friend. Can you please look and identify the image here? Can you please look and identify this image? This image was directly given. It is, I hope you are able to identify this one there. It is omphalocele. Perfectly right, sir. So it is nothing but the omphalocele. Now try to recall embryology classes. We studied about the rotation of gut, and we know that the foregut is going to rotate 90 degrees in clockwise direction, whereas the midgut is going to rotate 270 degrees in anti-clockwise direction, whereas the hindgut will not rotate there. Now, when midgut is going to rotate 270 degrees in anti-clockwise direction, normally what happens is there'll be like long coils of jejunum and ileum, and they cannot be accommodated inside the abdomen at that point of time during almost like 6th week. So therefore, what is going to happen, that loops of intestine, I mean to say the midgut is going to herniate out, and that is referred to as physiological hernia. Please remember, this was asked in NEET PG exam. Physiological hernia. Now physiological hernia कब होता है? Remember, it will be taking place on 6th week. So 6th week physiological hernia will occur. The loops of midgut will actually come out. But later on, what is going to happen? The rotation of gut will take place. That is 270 degrees anti-clockwise direction. Simultaneously, it is going to, yes, reduce back to the abdomen. Now it is going to reduce back to the abdomen by 10th week. So physiological hernia will reduce back by 10th week, guys. Now, thank God that you and me, we are like very lucky people. Your midgut, my midgut came out, rotated, went well inside. But there are some unfortunate babies. In those unfortunate babies, what is going to happen? It is physiological hernia to ho jata hai, but it will not reduce back. So there will be failure of reduction of physiological hernia. There will be failure of reduction of physiological hernia, and if it does not reduce back, then what is going to happen? That condition will be referred to as omphalocele, where you can actually see that membrane intact over there. So yes, that is nothing but your omphalocele over there, guys. Okay. The next one here, look at this image and try to identify what is this image, guys. Another important image which was given in your exams. Yes, absolutely correct. Absolutely correct, my dear friends. It is congenital diaphragmatic hernia. Congenital diaphragmatic hernia. Okay, congenital diaphragmatic hernia. And if you are able to tell me it is like congenital diaphragmatic hernia, can you please even tell me what is the cause for this one? We studied about this one in the embryology. What is the reason for this one? It will occur due to absence of one membrane. Which membrane? It is due to the absence of pleuroperitoneal membrane. Very good, very good. Please remember, I have included this image over here. Why? Because of course this image was given in the exam. Apart from that, there'll be like so many times in your PG exam, they're asking about what? The development of diaphragm. So development of diaphragm is very much important. Please try to learn that one. So when you learn about the development of diaphragm, totally 4 structures are required. Out of that, one of the structure will be the pleuroperitoneal membrane. If that membrane is absent, then what is going to happen? During development, the pressure will be actually more in the abdomen. Because of that, the loops of intestines are going to herniate into the thorax, and they are going to compress the lung hypoplasia, and all those will occur. So please remember, due to the absence of pleuroperitoneal membrane, it will lead to congenital diaphragmatic hernia. And now one last and final image, which is nowadays trending in your exams. Yes, of course, this one will be the craniorachis. Craniorachis here, sir. In this craniorachis, you can clearly see here, first of all, there will be anencephaly. There will be anencephaly here. The failure of, closure of the cranial neuropore. Along with the anencephaly, what is going to happen? Even the spinous process, the spinous process of the vertebrae, they will also be like failing to fuse here. They will not be able to fuse. So once the spinous process, the bony processes of the vertebrae are not fused here, then what is happening here? You're able to see the spinal cord clearly visible over there. So anencephaly along with the bony defect of the spine. Anencephaly along with the bony defect of the spine. Together, this condition will be referred to as what, guys? Yes, craniorachis. craniorachis कहते हैं. तो ये सारे images आपको पता होने चाहिए. So in this manner, my dear friend, we are going to end this session here right now. I have included almost all the important images. The moment you look at these images, you should be able to identify them in the exam. And I hope this session was useful to you. Thank you, Dr. Vinay Kumar. Thank you, Dr. Vinay Kumar, Dr. Pratiksha. Thank you. So by this, we are done with all the important images that is like must know, should know before going to the exam. Yes, of course, this will be available on YouTube. Please watch this session as many times as possible before going to the exam. Just one day before the exam. Hope you'll be able to revise all the images like neuroanatomy, head and neck, upper limb, lower limb. And yes, of course, as you all know very well, I told you in the middle also, I did not include like simple images which will be always observing, always seeing, है ना. आप हमेशा जो images देखते हो वो मैंने include नहीं किए. I don't want to waste the time. That is why, like, important images which you might miss, I've included that one over here. Okay. Yes, of course, we'll be doing LRR will also be like uploaded. Don't worry about that one. As you all know, like I was not well. That is the reason why there was some delay in that one. Don't worry about that. Even that will also be there. Thank you. Thank you all. Take care. All the best. Bye-bye.